All right. Hey, everyone.
We're back.
Kevin and Sean back again. So today we're here to talk to you about
TMJ. Jaw pain.
So TMJ is the temporal mandibular joint, for those of you wondering what TMJ is. So that's why we call it the most important joint.
Yeah. Acronym for TMJ.
Well, not really why, but it's because it actually is a very crucial joint in terms of you'll see what we're going to talk about, posture and its link on tensions down one side of the body.
Nerve innervation.
Yeah.
They say with 35 to 40% of the nerve innervation is associated with your face and your jaw and your head.
Yeah.
So it's such an important zone to get evaluated. And
Absolutely.
If you're dealing with jaw pain, clicking jaw, tension, headaches, neck pain,
often chronic one-sided pain, like shoulder, hip, knee, ankle, stuff like that.
Yeah. It's so important to have evaluated.
Yeah.
So let's hold up. We brought Jason in today, so he is here today.
Here's Jay.
Here's Jay. Hey, Jay,
Finally
how
made
you doing,
it,
buddy?
Finally made it.
Finally made it.
So what we wanted to show you today is basically the jaw joint here. So this is the
temporal mandibular joint.
The actual condyle that comes up and sits in what's called the temporal bone here, which is the ear bone. So the hole you see here is your ear.
Yeah, right in front of your ear. Right.
Now, quite often what happens, you can have many things because of musculature that helps open the jaw versus musculature that helps close the jaw. There can be imbalances that cause the jaw to be in an offset position. Yeah. Some of that would create discomfort on one side. So we often look at this when we see like one-sided tension in the neck, repeated things that keep coming back on one side, people that are suffering from, there's a whole bunch of symptoms. So we're looking at stuff like headaches, ringing in the ears, dizziness, imbalances, things like that, actual clicking and pain or the jaw locking.
Locked jaw, trouble opening the mouth. You should be theoretically able to stick three fingers of your dominant hand into your mouth.
Yeah.
And so if you have trouble opening, trouble closing, all these, like Kevin said, anything with the inner ear, trouble drainage, tension.
So it's funny because people ask all the time, well, it doesn't make sense. I don't really have pain there until you actually go and touch some of the muscles there, and they're really sensitive. They're small muscles, but it would be
so powerful.
They're very, very powerful. So why would they be off? So number one is often what happens is people will clench.
Yeah,
so they'll either clench, grind, which they often either do at night.
There's a neuro-emotional or a psychosomatic relationship between your jaw, the tension of your jaw, and the things, the thoughts you allow to dominate your head or your subconscious. So.
Exactly. So it usually goes with the level of stress that's happening in a person. Those periods normally they'll see them clenching a little bit more than usual. And then that in itself, building with time, creating that issue, will have repercussions somewhere else.
Can be trauma, can be impact to the jaw, to the chin, to the head. Any of that can create imbalance in the musculature or the disc associated with the TMJ joint, right? Your mandible and the like Kev said, the condyle. There's a disc that the condyle sits, or actually the disc sits on the condyle, and then the condyle articulates with that temporal bone into the fossa, the hole. So you could have damage to the disc. You can have
compression there,
cartilage, right? Issues, collagen issues, and these create different symptoms associated with that dysfunction.
Yeah.
So what are some treatment options for you? Actually, one of the most popular ones we hear every day is, I just got fitted for a mouth guard because I grind my teeth. And the term is bruxism, right? Really, really clenching. Does it work? Not really, right? It's a short-term solution. It's like a crutch, right? Yes, it might help you with the wear and tear on your teeth because you're not squeezing. I've seen cases where people actually just bite down even harder because they have... Right? But then they'll also create... if you wear that all the time, you'll create, not to mention, different problems with your teeth.
Good point mentioning the teeth, because the teeth can also be an issue of why the jaw is a problem.
Yes, if the teeth don't align properly, if you have a malocclusion, it can create tension.
So I've had patients, same thing, I find like mostly the night guard thing can help them maybe through a small period of time to decrease the amount of stress there if the issue is like quite severe. But then again, it really makes sense too to treat the cause, meaning, so well, why is the jaw that tight? So we'd look at stuff like treating the cranium, the neck, things like that to make sure that all also the balance of musculature in and around the jaw. So there's tests we do to make sure, well, which muscles are involved that are creating this imbalance.
Well, let's give an example of like an evaluation. If we were to look at someone's jaw, we would first of all look at the actual, articular components. So the way that the jaw opens, we would look for any deviation. You place your hands in the ear to see if there's any movement. We'll place our finger on the jaw to see if that condyle moves one side more than the other.
Well, the classic too is having them just open
the mouth, right, with the fingers in the mouth.
Because you'd see too, like
so check on Jason,
here. So as someone would open their mouth and they'd have like an imbalance, what you'd probably see is, I knew his face would come off. Sorry, Jay.
Sorry, Jason.
Okay, hold on. I'll hold his nose here. Is so basically the jaw would open and deviate to one side
versus the more,
and then potentially come back straight. And then they close, it deviates and comes straight again. So that normally would indicate the side it's deviating to normally has an issue. So
for you at home right now, next time you're brushing your teeth, see whether you can fit 3 fingers in your mouth. See if you can see when you actually open your mouth in front of the mirror. See if it deviates. Right, that means an imbalance. So it might not be causing you problems now, but it's definitely worth evaluating because the impact, like we say, of this jaw. Of the function of that joint is crazy throughout the body, so it's important to have it evaluated.
So what, like, great point about the body. Like, so why would you want to fix something like this? Well, obviously one of the reasons is because it's annoying to have pain in your jaw. Two, it's the repercussions on what it does to the associated structures in the body. So there's a very interesting fascial line. So fascia is like this connective tissue that surrounds musculature and organs and everything else.
Yeah, tendons, ligaments. They're all kind of webbed and wind together throughout the body, right?
So there's a massive one that goes from the side of your head, down the neck, down the inside of your rib cage, to the pelvis, all the way to your foot. So just to show an example of how...
Hey, Sherry, how are you?
Hey, Sherry. How crazy the link can be sometimes. I actually had
this is an interesting case.
Gymnast, I believe, at the time that was suffering from an ankle sprain, and it was a physio friend of mine that was treating her. But this was for a couple months, and the swelling wasn't going down. The ankle was still sore, so she sent her in, and we kind of evaluated her. I figured there's going to be something off with her back, but no, everything checked out. And the more I looked at her, the more I could hear her chewing. She was chewing a gum, and you could hear the...
Chewing gum is a very good indication of something wrong with the jaw, right? Because we talked about before, like movement helps, or I say the WD-40 effect. Movement helps cure all,
That's
right? You get that flow, you get the blood flow. So if someone who chews gum often, it's a good indication that they probably have some imbalance with their jaw.
So it's probably not a good habit to have. But so anyway, so we test out the jaw, and sure enough, the jaw is showing signs of being involved with what's going down that side of her body. So her mom thought I was a little bit crazy to say that, but I was trying to show her the link and everything else anatomically, and sure enough, day later,
fixed the jaw,
swelling was gone. Didn't even touch her foot, so there are some very, very interesting links with posture, with all the neurological impacts on the body.
The movement of your cranial bones, right? If we think about the jaw, we can think about like a pump, right?
Yeah.
So it actually, if we look biomechanically, I know Jason's jaw is not cooperating very well, but as it opens and closes, right, that's a pump. Well, we have something called CSF in our brain that bathes our nervous system. So this plays a role with the function of your cranial bones. So if they're, again, from this joint, right, we could then, if you have a problem there, we could evaluate the cranial bones. We could evaluate the musculature around. And try and improve that balance.
I think the most frequent one I see is someone complaining of always saying like, my shoulder's always sore and it won't go away. Obviously there are some other elements involved to issues like this, but a frequent one is on the same side, they'll have a compression in the jaw joint. So like Sean was saying before, key things to take away from this would be, pain on the jaw if you touch it.
Yeah,
Waking up in the
sensitive.
morning.
So
and
the
it's
muscles
sensitive.
of mastication, like the chewing muscles, right? If they're tender and they're sore,
They shouldn't be.
they shouldn't be, right?
No. Alignment. Right? Opening and closing. Is it opening and closing straight? Is it deviating? That's another sign. Chronic issues with pain in the neck and shoulders are often.
Right? Ear canal.
Yeah.
Ear infections, all those things. Drainage issues, like the ringing in the ears, balance issues. Evaluate the jaw.
So, I think that was it for pretty much all the symptoms and all that. So, in terms of
another
treatment,
really cool,
we could talk a little bit.
Another
about
really
the
cool
treatment.
thing the just anatomically the morphology of the body and its impact. Right? So Kev talked about this line down for this fascial line from the jaw down into the ankle. Well, if we look at actually the hip and pelvis, right? It actually it kind of looks like this would be your chin, the symphysis right here. There's a link between the actual pelvis and the jaw and the head and neck, with respect to your hip being the condyle and the joint, the TMJ joint with respect to the hip, and the movement that's essential for your hip, the balance that's essential for the hip. Well, it's the same thing up above. So the body's pretty fascinating.
The link that Sean was just showing too with the spine. If we look at, we'll pull it up again actually. So when Sean was talking about the dural matter as well, which is that kind of saran wrap that covers the cord and the brain. So everything, the spinal cord that would be on the inside of the vertebrae here, going all the way up to the head. So the dural matter is that wrapping around the cord. So
saran wrap.
When they talk about an epidural, epi's a needle, and dural is the membrane they're pricking to freeze you. So the dural membrane's kind of like, we said saran wrap, but it's not elastic. It's actually quite tight. And it fixates itself at the base of the spine and at the top of the neck.
And upper cervically,
So jaw clenching engages the little muscles that go from
rectus capitis, right?
To the head to the neck.
Head to neck, and your first cervical, your first couple vertebrae, to the base of the skull, right?
So what happens is it creates a compression at those levels. The dural matter gets tighter, so then you have people complaining of headaches, of the neck pain.
And that will affect virtually everything. That'll affect your CSF flow. So the flow of that fluid, like we have blood flow to every nook and cranny of your body. Well,
that's the key
nervous system.
Key to us being balanced, basically, is that motion, right?
So the most important joint is exactly that. It's essential to have evaluated, not just when you have pain, but for every
a lot of issues.
A lot of issues that are going
on. Not to mention the coolest thing, which I was only later on realizing how much the teeth actually have an impact on us. There's a huge relationship between teeth and different organs in the body and areas and musculature in the body. So imagine the offsetting of the jaw and having compression of a certain amount of teeth that are related to certain organ function. We find this quite often, that a tooth is actually a problem with how something's working.
And vice versa. Right?
Yeah.
So back to a little bit of the anatomy of the jaw. So we have the condyle, the angle of the ramus of the jaw. You have a disc that sits on top of that condyle that sits in. So you can have imbalances of the musculature, teeth. You can have tension issues. You can have clicking issues. So the disc can actually be not in the right place. You can have you can have cartilage issues. There's so many things. So it's so important. It's so important to have your jaw evaluated once in a while.
Sure.
So
well, obviously, if you have some of these symptoms, right? So if anyone ever has any questions on this or concerns about maybe them having an issue with their jaw, please feel free to call us. We'd be more than happy to answer those questions. And we look forward to bringing in the next topic for next week.
Yeah, next week we actually have a special guest. We're going to have Amy Samsonovich. She's going to come in because she's actually doing a presentation here the following week on mindfulness, meditation, breathing, and how it helped her with her concussions, and how she's done a lot of work now helping people just regain full function and health. So it'll
Yeah.
be fun.
Getting recentered.
Yeah, it'd be fun to sit her.
To
And
have her,
maybe the real Jason
We can make Jay do it.
maybe
Jay's going to do it.
Maybe he'll be here next week, but he couldn't be here today. Well, he was here
In spirit.
In spirit,
Yeah.
but he's actually having his jaw looked at right now.
Right. The other thing is I wanted to just thank the people that came out on Tuesday. Tuesday was a great night. We did our talk on adrenal stress and the ins and outs on that, and why basically those types of issues can have such a profound impact on us in our general health, our sleep, and general status. So it was great to have that crowd out. We had quite a few people, and they were really great. They asked a lot of questions, so there'll be many more of those.
Yeah, probably in the new year. I was just talking with Dr. Yassin. We're thinking maybe detox. Everyone's always concerned with after the holiday season.
Yeah.
So we'll probably do something on detox or inflammation or one of those things in the new year. Stay tuned for that. And this is actually a really cool
So April
comment.
Connor,
Yeah, this is an awesome
old
comment.
friend of mine, growing up, was my neighbor growing up. Hi, April. Good question about the braces.
Impact of braces, right?
The number of treatments we do on people pre and post braces is crazy. Just because there's prep work we do with orthodontists to prepare the whole alignment issue before they actually put the braces on,
Which is very important.
Yeah, and then
Post
throughout, sometimes there's a bit of a tune-up to be done, but mostly is after, because the braces, what will happen will cause restriction to in certain suture lines of the face and mandible and all that. So it's important to work those in order to reestablish kind of more healthier area around the jaw and the head.
And then also with the jaw,
Yeah.
We should mention too, it's important, and braces and the changes that go on. Also, it'll affect the position of your jaw, the position of your mouth, your palate affects your ability to breathe properly through your nose, right? So, which is such an important thing. There's also inflammatory, right? Different sensitivities that might affect your capacity to breathe through your nose, but all those things, like how far-reaching the TMJ is it's phenomenal. So it's worth definitely having it evaluated. So if you need our help, don't hesitate to contact us, and
We'll see you next week.
We'll see you next week. Have a great weekend, guys.
Take care.